I am a GP in South London. I'm also chair of 52 Medics Ascension Trust, a group of doctors who have been trying to share positive messages and put out the right message during this time of the COVID-19 pandemic.
So this year has been the most fantastically challenging period of most of our lives, physically and mentally. As a surgeon that works in the National Healthcare Service, I can tell you that we are once again seeing a healthcare service that is completely stretched and almost overwhelmed with the need to treat this disease.
And just coming to you this evening just to say I'm really excited about the news that's just come out about the Oxford vaccine being approved.
So it's important that we get this message out to communities that are vulnerable, people who have been misinformed, just to reassure them and just to say, look, please do not miss this opportunity.
For everyone, 2020 has been turned completely upside down. I don't know anyone, young or old, who hasn't been affected by COVID, directly or indirectly.
I know many people are sceptical about vaccines, and I just want to reassure people as a GP that vaccines have been around since 1796. Edward Jenner is considered the father of vaccine technology. However, vaccines have been part and parcel of many different communities across the world for hundreds of years before that.
Now, taking a vaccine is a choice.
But I know for many there's real concerns, and it's okay to have worries about it.
I just want to try to assure you as much as I can from my point of view. I've looked at the evidence, the trials have been done ethically and they've been well done, and the effectiveness of the vaccine is fantastic.
First of all, I want to reassure you that you're not going to be forced to have the vaccine. Secondly, I just want to say that there's lots of information going out there. I know that even as a health professional, I've had some dubious information sent to me via social media. When I've looked into the sources, sometimes the sources haven't even existed. Some of the information hasn't even made practical sense as a healthcare professional. Some things just look really, really scary.
So vaccine technology is always advancing, and like every medication, yes, there are pros and cons. Even paracetamol, there are pros and cons. That doesn't mean that it's not safe for the general masses. It just means that it's something that we have to be informed about, be aware about, listen to the right sources, and take an informed decision.
So I will be taking the vaccine.
I've had the vaccine. I want you to make an informed decision.
It is so important that we all recognise that we are at a really acute, pivotal state in our nation with the increased numbers of COVID-19 cases and indeed admissions.
Please make sure that you do your research from the appropriate, trusted and reputable sources of information. Take care.
And just to encourage you that if you do have any skepticisms or reservations, that's okay, but you can always search out information at appropriate sources such as the NHS website or talking to your GP. Thank you and have a happy new year.
You can always ask a health professional for more advice. There's lots and lots of resources out there that can give you real good information about actually what's going on with the vaccine and the process of it. We just want everyone to be safe, and the vaccines have been produced in a safe way, in a safe environment. So I'm all for the vaccine. I hope you will be too. But just remember, it's okay if you don't take it, but please make an informed decision and make sure it's a decision that's right for you.
I beseech you, make the right decision for yourself and your family